And I don't know why, because we're still babies ourselves. So
I'm
I don't know why
just
you
a
guys
child.
are having kids.
It doesn't matter how many books you read, how many Lamar's classes you attend, when you get there, hey.
That hey is experience.
Any woman, even if you don't have like mental stuff,
Yeah.
I think every woman, before you want to have kids, just go talk to a therapist. Just go talk. One thing we're not preparing moms for is the end of breastfeeding.
Okay.
So there is something known as post-weaning depression.
The only reason I'm scared of motherhood is labor and delivery. Nimemalizia hapo. You're not discussing
We'll
it.
sort you out.
Hey,
Yeah.
hey, my goodness.
See, I told you I've got bags. I've got tricks in my bag.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to make you make an informed decision. My name is Dr. Hope, and I have lovely guests today. First of all, their skins. Hi! No, you people need to tell me what you're doing with your skincare because wow! But let me let them introduce themselves and feel free. The floor is yours.
Thank you so much. I am Dr. Vundi. I am a psychiatrist, a board certified psychiatrist. I'm a women's psychiatrist, and what that means basically is I have a special interest in women's mental health. So things pertaining to birth, prenatal, postpartum, perimenopause, anything that affects your mental health during this time. I'm also a mom of one, so that's something I'm still learning. We are one, we're still growing, but it's one of my biggest accomplishments.
Wow.
Yeah.
I thought you were going to say too, because you have a dog as well.
I'm also a dog mom. Oh my. No, but one of my other things that I'm passionate about is content creation. I have my own page. My own pages. I have a YouTube channel that's the Self-Work Podcast. Also on Instagram, TikTok, and LinkedIn as Dr. Vundi, the women's psychiatrist. So you can find me there.
Wow. Hey, okay. Next, Doc.
Thank you, and pleasure to meet Dr. Vundi. I think we'll see her because to go perimenopause.
Yeah.
I'm harassing my whole house with my antics, but my name is Dr. Maureen Owiti. I'm an obstetrician gynaecologist. Everyone always asks this obstetrician is what? Differences, a gynae is a woman's doctor when they're not pregnant, and the other complicated word obstetrician is a woman's doctor when they are with child or pregnant. I work at 40 Suits, Gynecare, and we have a lovely gynae practice there. I'm not very social media savvy, but not scared to take a plunge.
Oh, yeah. I have a question for you, actually, because Dr. Vundi is on socials. Do you feel like with the current time and age, it's pushing you a bit more into getting into social media? Or you're just okay?
I think we'd have to do a lot more social media because the younger clients, that's where they're found.
Yeah.
It's bring a very different dynamic to how we used to practice previously, but you have to change.
That's true.
Yeah.
That's true.
The only constant in life is change.
Yeah.
Yeah.
And actually, you're one of the gynecologists. If anyone asks me, I'm just like Dr. Maureen Owiti. And then there's also like some of the ones who've been here, but I'm always just forwarding because of the experiences that people have shared from interacting with you. So let me just give you your flowers, your coffees.
Thank you.
You're doing a good job. And we continue like that.
Awesome.
So welcome, guys. Thank you for honoring the invite. This has been, hey, we've planned and rescheduled, but today is the day. So as we start, journey to Inside Out. Have you watched Inside Out, the movie?
No, but I've heard about it.
I've heard about it. I don't know if I watched it. I think I could have watched it.
It's about many
I'm just happy you've heard
emotions.
about it. Like that's somewhere. That's somewhere.
Yeah.
But yes, it's about emotions. And so when you go home, it's on your list.
I've watched it.
Oh, love it. Yeah. So
The moment you mentioned emotions, it's like, aha, I watched it.
You watched it. So basically it explains like why emotions come about, why we are the way we are. And I just wanted to find out today, where are you emotionally?
I'm in a really good space.
Okay.
So I'm at peace. My son is he turned 2 the day before yesterday, so he's 2. and we're celebrating him tomorrow. And I feel a sense of peace and calm. I feel like finally, after a long time, I kind of feel like I know what I'm doing with motherhood. Because, and we'll talk about this more. There's a period when I was just like, hey, what am I doing? When will I feel like I know what I'm doing? So I'm at peace. I'm happy. Professionally, I feel like I've found my footing. I am working because I like to work. I'm not in a place where I hate my job because I was there some time back. So professionally, I'm good.
Okay.
And in my personal life, things are good.
Wow.
Yeah, marriage works.
We love it for you. We love it for you. Yeah. And we actually had, I don't know if you want me to say this.
Yeah.
But we had Dr. JP, who, this is a medical household.
Oh, yeah.
And we had a great conversation with him. So it's nice to come full circle and have you here as well.
Okay.
What about you?
Okay. I think we mentioned we're perimenopausal.
Yes.
So, but generally, I think if it's not for that, and driving everyone crazy, me, I'm like, are you deal you? Me, I'm me. I think what comes with age, and I think that's driving everyone crazy, is like, you're now not afraid to speak your truth. So you're not bothered about whether they like it or don't like it. So I think it's more people adjusting to the new me.
Yeah.
Because I was generally that type of person whereby you don't want to hurt people's feelings. Nowadays, I'm like, this is like this. Shoot, I shoot from the hip.
Unapologetic.
Unapologetically. So I think, but generally, I'm always a happy person.
Yeah.
So always happy. With family, I have 2 amazing kids. And we're in transition. So my daughter's 15, so we're going through 15-year-olds. But all said and done, they're amazing kids.
Yeah.
So and I really thank God for them. And I thank God for their father as well. He's been very supportive in the journey.
And we love to hear that. We'll have a supportive partner. Yeah. I think for me, I'm excited. I think because I've met Dr. Vundi, but I hadn't met Dr. Maureen. We've talked a bit. So it's nice to actually see you and actually get to enjoy. I think you're very jovial. And there's just something, like she just entered the room and it was like, woo. Yeah. So I'm enjoying that. So I'm excited. Something else is, I'm a bit tired of one particular thing. Guys, I'm tired of eating in life.
What do you mean?
I'm just tired of food. I'm tired of chewing. Like, you guys feel like chewing is a workout? I know it's so random, but
absolutely not.
I was just thinking about it. It's lunchtime and I'm just like, I'm literally tired of chewing. Like, again, then we'll chew again in the evening. I'm tired.
It's fascinating because I was speaking to my husband about my son. He's a fussy eater, and I was just asking him like, see, he just eats. Like, food is yummy. Why are you not eating? And
we are tired.
Life has so many things. Food is one of the things you can just like enjoy. But I hear you. But I hear you. There are people who just.
I'm actually not a foodie. Yeah, that's exactly what it feels like a chore. I eat to survive, not because I really enjoy food. Like, it's nice to eat, but I'm tired.
Oh, that's okay. That's okay.
Anyway, it's nice to have you guys here. So now, next thing, medical jargon. Your doctors, what is one thing you want to debunk? One thing you want to explain to the audience? Maybe they keep getting it wrong. The floor is yours, doctors.
For me, I want to debunk the difference between a psychiatrist and a psychologist.
Okay, that's a good one.
The number of people who reach out to me and they are like, Dr. Vundi, I need therapy, So I have to go back and explain that I'm actually a psychiatrist. Oh, what's the difference,
Yeah.
So psychiatrists are medical doctors. That's the only difference. Whereas psychologists are not. So psychologists, there are so many different types. We've got clinical psychologists, counseling psychologists, counselors. So what they do essentially is similar to what we do. So they diagnose and they treat, but we just do it differently. So we all diagnose, we all treat, meaning we can diagnose, you have depression, you have anxiety, because that's not hard. We've got manuals that guide us. But then the treatment is different. So psychologists don't medicate, right? Whereas psychiatrists, we can medicate if need be. So we are the ones who are qualified to do so. and we treat in a very surgical precision sort of way,
Mm-hmm.
whereas therapists kind of want to figure you out, and it's more explorative.
Yeah.
But for us, sometimes when I tell my patients, when I'm seeing you, it's like I'm fishing. It's very targeted. So we're not going to spend hours and hours and hours talking, but trust me, at the end of the 30 minutes, I'll kind of figure out what to do.
Yeah.
So that's my thing.
But you also work hand in hand, yeah?
Oh yeah, it's very collaborative.
Yes.
And I don't think one is superior to the other.
Yeah.
There's that beef.
There's that beef.
Yeah, but for me, I've got so many psychologists I work with.
Yeah.
I like them. I think they're very important.
Okay.
Yeah.
Great. That was actually a very good one. What about the obstetrician gynecologist? By the way, it doesn't have to be specific to your field.
Oh, okay.
Yeah, if you want to, that's fine, but see a must.
Because I'm an obs gyne, let me just
You all say
let me
that.
just
Let me tell
dive
you.
in the field that I understand. So mine is the difference between a UTI and candidiasis, because a woman will come in and she tells you she has candidiasis.
Mhm.
You're like, okay, what are your symptoms? And she starts, oh, I'm burning when I'm urinating. I have painful urination. I'm going to the toilet all the time. And I'm like, so how is that candidiasis? So candidiasis is actually when you have a discharge. It's normally white, like yogurt or maziwa mala. I think Kenyans would understand maziwa
Yeah.
mala. For those who don't understand Swahili, that would be curdled milk, so, or spoilt milk. And that type of discharge, it causes a lot of itching in the vulval area. Whereas a UTI is an infection of the bladder and is associated with low abdominal pain, burning sensation when you're urinating, going to the toilet all the time. So that's just a difference. So probably not come and tell the doctor what they have, probably describe their symptoms and let us decide what it is. But at least that's the difference between a UTI and candidiasis.
Yeah. And maybe another difference, because it's discharge, it's not foul smelling.
So,
It doesn't have a smell, because now that's a
Yes.
different playing ground.
Right.
Yeah. Okay. So today we have these two lovely guests here, because we started a series called A Journey to Motherhood, and we had a lovely doctor as well. She's called Lean. She shared her experience through conception, pregnancy, labor, postpartum, and it was just nice to hear some of the struggles she went through. But now we want to talk about from labor to postpartum, like as a woman, as a mother now, how do you come back to your, I don't want to say true self, maybe your new self or your new way of being as a mom, in a way that you're able to show up and thrive in this space of motherhood, but also be what your child needs at that particular point in time. So some of the challenges we constantly hear in health is we do not listen. And for the stories I've had with my friends, because now we're in this age where people are having children, and I don't know why, because we are still babies ourselves. So I don't know why
just
you
a
guys
child.
are having kids. But many of them say that the birthing experience was traumatic. They didn't feel listened to, they didn't feel heard. So Dr. Maureen, because now that's your docket, what do you have to say about that? And also, is it something that you have seen? And how do we work around this to make mothers or people, ladies who are entering this journey, a bit more comfortable because this also transfers to postpartum? Yeah.
Okay. So I would really how do you say, feel what the women are saying, that they don't feel heard, don't feel listened to, because if you look at most busy gynecologists, they have this queue, and you have to make that balance between how long are you taking with the patient and how long are you keeping your queue waiting for you. So it's just striking that middle ground. Some of the ways, and I like the way she's described the collaboration between the psychiatrists and psychologists. We also do collaboration, and you can collaborate with families. So I presently have a client who every time she's coming in, she's with her mother, the husband, and we involve them in the healthcare. So some of the new changes is how we're having more male involvement in the health of the women, and we're very happy that the men are really showing up, and it makes a difference. So when the woman feels supported by those around her, it makes that experience that much lighter.
Mm-hmm.
Having had said that, quite a number of my clients do come in with their partners, and I have one who just delivered recently, and she's like, "Hey doc, why did you tell me motherhood is like this? Because it's a new mom. You have this kid who everything is meh. It's the first time. You don't know this is angwe for I need a diaper change. It's angwe for I need to breastfeed.
Yeah.
It's angwe I just want to be carried. You understand?" And she was really feeling overwhelmed, and obviously she has had lack of sleep, and it's something personally I could relate to, because I think my own experience, also when you're first time mom, you can't tell the difference. All
Yeah.
cries sound exactly the same, and then it's like you're excited, your friends are coming and everything, so you're just like, okay, I just feel like, you just have to slow it down.
Mm-hmm.
Just slow everything down, and you just go down to basic. That the floor wasn't mopped today, nobody's gonna die. You understand?
Yeah.
So what I say is, stop trying to be a super woman.
Mm-hmm.
Yeah, you don't have to be a superwoman. You just have to be mommy, and you have to, and remember, and I told her, for the household to be sane, the one person who has to be sane is you.
That's true.
Yeah, the moment you're not sane, the whole household is going to go upside down. Okay, so you have to focus on yourself first. So I'm just like, just slow everything down. Start with what must be done. Okay, and then from there, as you learn the baby, and you see, like she's saying, she's now 2 years, she now understands, things are flowing.
Yeah.
And I'm like, it's just a matter of time. It'll pass.
Mm-hmm.
The way you are at 2 weeks, at 3 months you'll be a different person. At 6 months you'll be a completely different person. Another change is going to come in, because it's not like they're constant, that they keep evolving.
Yeah.
Because you move from breastfeeding entirely, and then now you're weaning, that weaning process. So it's just that, and then also just preparing mothers beforehand for labor. And I say labor is exactly that word. When God or whoever came
It's
up
a
with the word labor, alikuwa najua ile anasema,
Yeah.
because really it's exactly that. But we thank God that we have a lot of things in our arsenal that can help mothers cope. So the first was having your inner circle, or those who are close to you, be present during your pregnancy and delivery process. Then we have professional people I was talking about. We have what we call doulas, and or birthing companions, but professional, who are there and they can work with you. Of course, it costs money to have them in, but if someone can afford, it's one of the ways that will actually make that whole delivery process that much lighter, that much bearable. Because unfortunately, yes, I'm the doctor. The way she's saying, the psychologist can have time. You'll have a whole hour. Utaongea, utatoa roho yako yote. Yeah, me, I'll come do my VE. Is everything okay? Heart rate iko sawa. Sister, weka sinto. I'm out of there. Understand?
That's true.
But the doula will be there. She'll be with you. And you also have going for Lamaze classes. They really, really do help. So it's how do you help them beforehand with arming them with the information so that they have some level of awareness. Challenge is, it doesn't matter how many books you read, how many Lamaze classes you attend, when you get there, hey.
That hey is experience.
You're there. But if you're very excited and you're very determined, it's something I say God has given women the grace to go through the labor and come out on the other side. So, and if that doesn't work, talk to us. Kuna vitu kama epidurals. Yeah. Of course, it costs also. But it's available.
Actually, now that you've mentioned epidural, I keep seeing this being thrown around, augmentation and induction. Could you mind just explaining to us what the differences are and also the duration? I have a friend who actually was induced, and of course induction takes a while. It can take more than 24 hours for it to work because of the cycles, right? But then it's like we don't explain to them, so they're just like, I was induced, I mean, see, now the baby should come out. So just how do we break it down to them just to understand that even in labor, when you're induced, it can still take time?
Okay. So it's very simple. Induction is for somebody who's not yet in labor. Yeah. So for whatever reason, the baby has passed the due dates, you've passed the due dates. I think the most common reason right now is because of we're seeing a lot of hypertension or preeclampsia in pregnancy. So, or like just say she had ruptured membranes, you're worried. You don't want her to stay too long and get an infection, just whatever reason. But with induction, the mother, when you're starting the process, is not in labor. Okay. And methods are various, but I don't think
we
that
don't need to go into
we don't need to go into that. Then with augmentation, you could have had an induced labor or you could have had a spontaneous labor, but we're already in labor and we feel the progress of the labor is not the way we want. So we want to weka ikwekwa ile graph yetu
the graph,
ifuatilie ile graph yetu turudishe kwa style. So that's now we'll give some medication to help the contractions come a bit more frequently and help the labor, the cervix to dilate and the labor to progress as we wanted. So that's just the difference.
Nice. And now you talked about the journey, preparing for labor. Now, this is to Dr. Vundi. And guys, I want it to be a conversation. I don't feel like I'm interviewing you. So interject.
Oh, right. I've been meaning to interject. But I'm like...
No, interject.
No, but also I'm learning again.
I know
the last time I did Obs-Gyn was years ago. So I'm like, oh, right, yes.
Yeah, you're like, patograph. So when I was talking to Lean, she mentioned that she started the journey with her psychiatrist. So she's had some she calls them mental health spices. So she was in and out with her psychiatrist, and her psychiatrist had to clear her even before conception. So even when I look at this process of now deciding I want to get pregnant, do you feel there's a need for bringing in the mental health aspect 100%. From the beginning and not necessarily starting from postpartum? Because postpartum is now when we're seeing, mental health challenges are here.
So I think that's very brilliant that if you know you've got some mental health stuff going on, I think you should do some sort of screening, pass by your psychiatrist, and find out if, one, this is the best time for you to have a child, because it could be a timing thing, or why you even want to have a child. So I've had situations where, people want to have kids because of their partners. Or I feel like I'm getting old, you know, but I don't think there's any mental health issue that can prevent you from having a child. And it just means we will have to work together. So I'll give my own example. So I went through, I always had anxiety, and it became very bad during my pregnancy. But luckily, my gyna was really working to, nudging me in the direction of the psychiatrist and the therapist. So there was a really good balance. And after I gave birth, I still got postpartum depression, which is fine. But I feel that because I was monitored, there was someone holding my hand, I already kind of knew. It was gentler. It was still brutal, but I believe it would have been worse. But to be honest, if you have any woman, even if you don't have like mental stuff, I think every woman, before you want to have kids, just go talk to a therapist. Just go talk. So much stuff comes up when you become a mom. Like mommy issues you didn't know you had pop up. Yes, you start realizing, Haya, kumbe had some issues with my mom, or my mom didn't do this, or I wish my mom did this. Daddy issues, issues with your partner. So I think it's every woman, whether you've got a history or not, just go talk to your therapist, so that by the time you're giving birth, you don't project your stuff onto your child. Because I've seen a lot of anger when the child comes. So people are very angry, bitter, but you're taking it out on the child, but really you should have processed your own stuff. So that's a really good preparation. And one thing that I really like that's going on nowadays on the socials, a lot of young women are actually being honest with themselves when they say, I don't think I want children. Like that conversation, the child-free conversation, women are empowered. Now they can say it. And I think that's very empowered, because there is a reason why you feel that way.
That's true.
So honor that. Don't feel you must have a child because you're in your 40s, or your partner is like, hey, let's do it. If you feel like it's not for you, I don't think you should. Yeah.
Because it's for life. It's not a
Yeah.
the
Yeah.
child comes and then, oh, I'm
Exactly. You
tired.
can't take it back.
Yeah.
Yeah.
And you talked about you're a women's psychiatrist and you talked about birthing. So what do you do, especially for women who are going through
Right.
the birthing process? Maybe you're preparing labor and delivery before they get to postpartum.
Before. I
Yeah.
mean, I work with women. To be fair, I work with women all through their lifespan. So even at the point of fertility, like you're trying to conceive, so screening for these things, like I do have a predisposition to depression, anxiety, insomnia, but during the birthing process, that's when we tend to see a lot of the things that were underlying, now they're popping up.
Okay.
I'll give you an example. During just after delivery, a lot of women get anxious. So postpartum anxiety is the most common mental health disorder in postpartum. It's around
Okay.
80% of women get it, but we talk more of the postpartum
80 is a
depression.
lot.
Yes, postpartum anxiety, that feeling of, what if my baby doesn't wake up? Is this water too hot? What if, the what ifs,
Yeah.
and a lot of women, it's because of underlying things. So maybe you have ADHD and it was never diagnosed. So now, because you're a mom, there are more demands on you. And with ADHD, you don't have executive functioning. You're disorganized. You're not timely. You can't be that way in postpartum.
Yeah.
Everything is on a clock. You've got to be organized. So a lot of women who have postpartum anxiety, when I screen them again, I find out, oh, kumbe you had ADHD. Or kumbe you had OCD, and now your world, with OCD, everything is organized.
Yeah.
But now there's no order. Your nanny is doing their own thing. Your partner is doing their own thing. So,
the baby is doing its own thing.
Exactly. So in the postpartum or peripartum, I do a lot of screening just to see if there was any underlying thing. And if I feel like there's nothing underlying, I just hand them over to the psychologist to just keep working with you just in case.
Okay. I'm learning something. Anxiety. I was one of those who thought postpartum depression and blues were the most common.
So blues is the most common, but we even don't consider it a disorder because it's natural. And all women will have postpartum blues. But now, as a disorder, postpartum anxiety is the one that's high up there.
Okay. And now, Doc, because sorry, we are all Doc, yeah.
Doc.
Dr. Maureen, because you're talking about now getting back to being you or your new you. As you've delivered, you also need to heal. Like, I mean, life has happened, things have happened. So what's your advice to mothers on how to heal? I know postpartum can be very demanding and you want to be a super mom. Like, I think that's like the natural thing that comes out. But how do you advise your patients to heal and to heal in a way that is positive for their home, their child, and everything around them?
Okay. So I think it's very opportune that Dr. Vuduma is here. Alisa,
Vundi, Dr. Vundi.
You're baptizing me. It's okay, I'll take it. I've been called Fundi. I've been called Bumbi. It's okay.
I don't know where I got that, mom. Hey, Dr. Vundi, I'm so sorry about
okay.
that. At least we'll have a point of reference of where to send my moms, and one floor up.
Upstairs.
One floor up. It's something for a lot of my moms. We discuss with the patients beforehand, and I think it's good that we have somebody who does this like on a more professional level, because I said what I'm able to give is just the more gynae oriented type of information. And one of the things I tell them, like something as simple as breastfeeding. One of those breastfeeding champions. Ile Baya Damu.
Happy World Breastfeeding Week to you. To both of you.
So it's something that for majority of my moms, we walk them through. And one is just give that positive reinforcement. So a lot of the gap is, again, information. And I tell them, look, go research. What are the benefits of breastfeeding? Okay. And you find the moment they understand what the benefits are, they're more likely to be highly motivated about it. Again, about the blues. And I say, again, that's something that's going to affect breastfeeding. Okay. And I tell them, I don't know how you're going to do this, but you have to process Are you having some underlying issues with mzee, finances, whatever it is, because it's life.
Yeah.
You can be having your baby, things are going well, a job you wanted, ghafla imetoka, and you still have to have the baby. What
Yeah.
happens? And I'm like, look, there are problems that really you can have a solution to them. Process, try sort those out. The problems, look, it doesn't matter whichever direction you look at, you're not seeing a way out. And I believe in higher beings. Mine is called God.
Yeah. Same
He's
here.
one. And he's one. And I'm like, it's also a time whereby I think also tap into your spirituality. Because I don't know if you've realized, you've had this crazy, massive problem that really you didn't know where the end, there was no end in sight. And over time, you find it just somehow resolves itself. Of course, when you're in the soup, it's difficult. But just say some things, leave it to God. At this time, put your baby and yourself first, and just try to do what it is you can. But I'm happy I now have a point of reference where we can send people.
I'm so happy we're having this conversation because just as she was speaking about preparing for breastfeeding, one thing we're not preparing moms for is the end of breastfeeding.
Okay.
So there is something known as post-weaning depression.
Wow.
Exactly. So when women start weaning, even if you're not completely stopping, but when the weaning reduces, your oxytocin also is falling. Yeah. And remember, the oxytocin is the one that makes you bond with it, feel warm and fuzzy. So some women experience a little bit of depression in that season. I went through it and I didn't know what was going on. So I went and spoke to my therapist, and they're the ones who told me there's something called post-weaning depression. So, even getting the label, because I was like, what's going on? I thought I was in the clear. My son is one. Everything is good. So preparing them that even the end of breastfeeding is a hormonal process that might come with mental stuff, then at least they know. So I think that these conversations need to be had. And also when you stop breastfeeding, there's a feeling of, what? It's so heartbreaking. Yeah, I'm even remembering, I'm tearing up because it's the thing that makes you feel like supermom. Like when you have that lockdown, you're like, then when it goes away, you're like, okay, so what am I now? Like, so we need to prepare women that you're also more than that. And when the time comes to breastfeed, to stop breastfeeding, it's okay. Just you're still a mom, you're still their mom. So that's a conversation we should have more
For
of.
sure.
Yeah.
For sure.
And I really like the way she's saying she's still a mom.
Yeah.
One of the things I tell my clients is that in your child's world, you are the best mother in the world.
For sure. Oh, you feel affirmed?
I'm so affirmed. I didn't know this was therapy. Oh, yeah.
But it's true. It's actually
In
true.
your child's world, you are the best. You're the most beautiful, best cook, best. There's nothing utaambia mtoto wako that you're not. Of course, to a certain age, you get teenagers, then but at least in those early phases. And I think also personally, I really had that crisis. I had that superwoman syndrome. So it's like you're welcoming all the visitors, the house is sparkling, and you crash because you're not sleeping. You're not sleeping. You're up 24, and your body is not meant to do this. So again, just step back, calm down, do what must be done.
Exactly.
And and I tell guys, you went to clinic, you're 2 weeks. Did the baby add weight? If the answer is yes, okay, sorry for those who, in case the answer is no. But again, if someone had that positive reinforcement, all of that, things tend to go well. Baby has added weight. Imagine that's a positive reinforcement. You're doing something right. You're doing something
And even
Right.
if the answer is no,
Mhm.
we've picked it up. So we
Yes.
can work on, you can find
Yes.
out, okay, why is baby not adding weight? You know, and you've also mentioned clinic. Now, importance of clinic. But before we get there, Doc, what are some danger signs postpartum? Because I know when you talk about danger signs during pregnancy,
Yes.
but even in postpartum, there are danger signs. What are some danger signs that
Okay, so
we should
for
look for?
both mother
Mhm.
and baby.
Mhm.
So for mom,
Mhm.
obviously, we the areas that we always examine are the breasts,
Mhm.
okay, and then there's the effluence or the discharge
Mhm.
after delivery.
Yeah.
So if the breasts are feeling engorged, like they're sore, they're
Mhm.
tense all the time, you're having the cracked nipples, don't wait for it to get worse.
Yeah.
You just need to learn how to be on it, because if you don't manage the breasts well, you'll get an abscess. If there's anything you don't want breastfeeding, there are two things: it's cracked nipples and a breast abscess. Okay.
Yeah.
Cracked nipples, for majority of mothers, we and I'm very happy in majority of hospitals, even in public hospitals, we help the mothers learn how to, for the baby to latch on the breast very well. The baby has latched well, and the secret is, your baby's breastfeeding, you should see their mouth moving,
Mhm.
you should not hear a sound.
Okay.
Yes. If you hear any sound,
Mhm.
your baby has not latched well. You're going to
Mm.
get cracked nipples. Practically, you have to be shown,
Yeah.
helped, because even for me, it took me about 2-3 days to establish proper latching with the baby. And I tell people, by the way, don't worry. There's that person, their milk, their Tuzo grade cow. Okay? It's not a competition.
Yeah.
It's not a competition. Okay?
Mm.
But if you're positive, you're being supported, most women supported, being patient with them, they should be able to establish breastfeeding.
Mhm.
Having had said that, you've not taken care of these other salient things.
Yeah.
And I've seen somebody who breastfed their first baby and was completely unable to do breastfeeding for the second baby.
wow.
Yes. And all because they had a serious problem with the partner at home. It was, things were going almost divorce levels, and was completely unable to establish breastfeeding. So you'd imagine that somebody who was breastfed before, it should just
Yeah.
Automatic.
so these things matter. So it's I may not have directly whatever, but I hint at that. Look, can you soul search and see, so that try to bring your your external and
Factors.
internal, because
Yeah.
they're also internal stressors
Yeah. Down.
down,
Mm.
and you have a positive breastfeeding experience.
Mm.
Yeah, so those are just some of the things that we need to do. Then obviously for the lochia, as we call it,
Yeah.
if it's having any foul smell, or you're bleeding very heavily, those are some of the danger signs. You're having a fever,
Yeah.
those type of things. Baby is very simple. Baby should breastfeed. When they breastfeed, most babies are not irritable. They shouldn't be crying all the time, refusing to feed. So when the baby refuses to feed, that's a very serious sign. A baby that's feeding well will poop and will have urine. They're not having urine, they're not feeding, they're not pooping.
It's a problem.
Those are problems. Yeah, so just some of those very critical ones.
Yeah.
But main thing is, how do we try in advance to preempt what they're going to go through? And I like this. Even me, I'm
Yeah.
hearing about post
Weaning.
weaning depression.
Post-weaning,
I'm just
yeah.
like,
Because there's
wow.
some things you can't
Yeah.
preempt.
Yes.
Like
Yeah.
some things that I went through that we only found out later,
Mm-hmm.
much as I'd been going to clinic severally,
Mm.
is so there's this thing where if you have cracked nipples and your baby has thrush, it can give
Oh.
you nipple candidiasis.
Yes.
Mm-hmm.
So that even when the cracks heal, there's still pain. Yeah. So now I kept on wondering, why is
Adding it to my list.
it's for
With the girl, where's the girl with the list?
No, because the cracks have healed while
Yeah.
you're still in pain.
Mm.
And so after working with, lactation specialists, I was on TikTok. By the way, I TikTok is where I found TikTok and Reddit. I found other moms with the same thing, went down a rabbit hole, fluconazole and a cream later. Like 3 days later, I was good. So there are some things also you can't preempt, I think, but lean onto other moms. There is so much wisdom, like in terms of like other women who've gone through things. I know there's a lot of information and it can be
it can be hard to
a
internalize
lot.
all that for sure.
But there's so much wisdom. Like when moms sit down and discuss, like in those subreddits for breastfeeding or TikToks or even professionals who are on social media, you will learn a lot.
And these days is also WhatsApp groups.
There's what
with moms, with pediatricians, with gynecologists, with psychologists, with therapy. I mean, psychiatrists should also be in those groups.
Agreed,
so you're just having like a rich conversation. A mom is like, 100%. Oh, me, my baby is, oh, me, my. Then the pediatrician is like, okay, fine, maybe just go to the doctor for this, you know. So it's nice, it's really affirming, and I think it gives them that sense of community. Because I think hey, look at me saying, I think the moms are here. Sometimes from the outside, it can look very isolating.
Oh, it is. So I was in a WhatsApp group. It's even we are still in the same group till now because we're still navigating things. Life-saving. Like, because sometimes it takes somebody saying, yeah, even me or me too, and you just feel like, okay, I'm not going crazy, or my baby is not. And sometimes we'd be texting each other at 3 a.m. They're like, who's up? Even me, I'm up. This one has refused to sleep, you know. And then it's like a little laughter in something that's so draining, where maybe your partner is asleep, he has to work tomorrow, your doctor like is not awake at 3 a.m. and it's not polite to. So you quickly ask, who's awake? And you find someone is awake and they come through for you.
For sure.
So I highly support groups. What I would say is sometimes WhatsApp groups get intense. If it's like too many people, then that's like, if you're 30, I don't see what the value.
30 is too many.
I feel like people can, especially in postpartum, remember capacity. I don't know about other people. For me, I just felt I can't deal with like 30 opinions.
Yes.
Because everybody has a point of view. So you know thyself. For me, we kept it, I think we were about 6.
Okay.
So because I feel like people can start bickering over, no, this is what I think, no, me I think. So like just be very cautious entering into some spaces.
For sure. And do what works
I really
for
like
you.
what she's saying about wisdom from other moms. I think mine was an incidental whereby I think one of my friends was having a party, and again, see me, I told me as those superwoman people. So as those people, iko na mtoto ako na t-shirt na diaper, tuko kwa supermarket.
Wow.
I was like, they're not cold.
No. I think I'm an Oreo.
I see. Fair enough.
So I prescribe to the fact that the temperature, if you're feeling cold, your baby's feeling cold. You're not feeling cold.
Okay.
Your baby's not feeling, because you're in the same environment.
Exactly.
You're in the same environment. So I prescribed to that very much, and we're born December. It was a bit hot. So so t-shirt
July like
and
some
diaper. Tumemeka hapo kwa hiyo nakumat kitu. I miss
TBT,
nakumats. I miss nakumats. Oh my goodness. But the person who saved my life were just at a random party, and I was with the baby, because my baby was my handbag. I went everywhere to establish breastfeeding and stuff like that. And of course, so it was now still new mom, now you're getting drained, and she was all those tips of like, you're doing well. And she's like, look, you'll get 1,000 advice. Just listen, be gracious, because people are coming from a good space. They're not doing it to
most of the time.
To distract you. But experiment and do what works for you. There's
that part.
Because there's this works for you, but this doesn't work for my baby. So it's good advice, but it's not working for us. So it's just listen, so the advices are good, and as I've said, it works for your baby. I'll try if it works for me. Cheers. It doesn't work for me, I'll moving on swiftly. It's okay. I'll try something else until I find what works for us.
I like that. That's actually very critical information, because I think these days we are so guarded, and I think it's warranted, but sometimes the advice, it's for real, it's not coming from a bad place, but you have the free will to filter and decide, I can use this,
All right.
I cannot use this.
Exactly.
You know, you make that decision. Now, before we go to postpartum, because I really want to talk about like now the
Yeah.
mental health aspect and the
Yeah.
conditions. Doc, there's one red flag or danger sign that I think we forgot. Remember when it comes to eclampsia and preeclampsia?
Yes.
We normally just, many times mothers would think that it ends after delivery, but for some it can continue, and even others it can start in postpartum. So if you've had eclampsia or preeclampsia, convulsions also something to look at. Monitoring your blood pressure is very important, and your clinics are also important because that's when we can also see the trends and assess.
Okay. I really like that you've brought that on.
Yeah.
By the time she's having convulsions, definitely we really missed
Something.
the bus, but
Yeah.
it happens even in the hospital that
Yeah.
woman was having normal pressures, had an uneventful delivery. You're preparing to discharge, and from nowhere,
Yeah.
convulsions
Yeah.
start. Fortunately, that's not the norm. But what would be signs that someone's having elevated blood pressure?
Yes.
I think the most common for everybody would be headaches. Challenge with headaches. Headaches is one of those things, whichever disease you have,
For sure.
headache iko hapo.
Whether it's a hangover or a brain tumor. That was said by a
love that.
pharmacist here.
That is so true. That's so true, actually.
Yeah.
Yeah, but signs that probably things are really not going away. So really persistent headaches. Headaches, most women hydrate, eat well, should something that goes away. Maybe take a paracetamol or so, it should go away.
Yeah.
So it's something that you've done, all that, it's still persisting. And again, by the time you start having visual, like you're seeing stars or your eyes are cloudy, you're having epigastric pain, don't sit down and think it's just an ulcer or gastritis.
Yeah.
I say for pregnant women, until they reach that 40, arubaini, like Swahilis and Islam,
Yeah.
I think it's a very physiological religion. Okay, so the 40 days after delivery is what we'd consider the postpartum
Okay.
a postpartum period, and it's called arubaini. You can just imagine.
Yeah.
Until they reach that, I say you are walking time bombs.
Yeah.
So I'm like, I love my pregnant mamas, but for me, the moment I've put you on, you're my walking time bomb. I'm waiting for 42. You click
sure.
42. I'm like,
Yeah.
hallelujah.
We can celebrate
We
kidogo.
made it.
Because
We
actually
made
walking
it.
time bomb,
Yes.
even PEs,
Yes.
pulmonary
Oh,
embolism.
Yes. Yeah.
Yeah,
So-
especially
The
for
amniotic ones?
amniotic as well, but even
embolism?
just
DVTs.
the blood DVT, especially with mothers who've gone through C-section, it's very important to tell them walk, move, move. Yeah, because the same way you're at high risk during pregnancy, even after, the risk is still the same. Now, let's get into postpartum.
Oh, girl.
Tell us about it, because it's I wouldn't want to say it's become the trend, but we're seeing more and more people talk about it.
Yeah.
So what are some of the things we should look out for as
Yeah.
moms, and how do we manage them, and when should we seek
Help.
advice?
So when people ask me about postpartum,
Yeah.
I'll say it's like many things in life, like breastfeeding. It's like marriage. So when it's really good, it's really good. But when it's bad,
Yeah. That's what you said about
really-
breastfeeding.
I know. That's what she
Yeah.
asked a question on her social media about, like, if you were to describe breastfeeding, what would you say?
Yeah.
And that's exactly what I describe it as.
Yeah.
Because for me, postpartum I miss postpartum.
Okay.
I would hold my baby and breastfeed, and I contact napped my baby. I would hold him, and we both of us, we black out, we sleep.
Yeah.
Like 2 hours later, we wake up. Like, there are such good moments. The first smile, it's a beautiful time. And then you're not working, so there's that.
Yeah.
In terms of like work, but like you're working in terms
Yes.
of taking care of the baby.
Yeah.
There are really good things about postpartum, and I wanted to say that because there's also like too many horror stories.
Yeah.
So I don't want women also to think like it's going to be
It's all negative.
it's all negative.
Yeah.
But when it's bad, the sleep deprivation, I like to say that during postpartum you are a bit delusional. There's nobody who functions well with like 2-3 hours of sleep. You're leaking everywhere. Maybe your nipples are cracked. Maybe you have a fussy baby. no one can function. So it kind of feels like sometimes you're just moving. You're just on autopilot.
Yeah.
It can get really dark. So these danger signs, if you're having any negative thoughts towards your baby or towards yourself, thoughts to harm yourself, or it can be very passive thoughts like, I just want to go and not come back.
Yeah.
Yeah. I remember feeling like I want to get out of this house and go, and I don't want to come back, and I don't want anyone to ask me anything. So if you're having such...
I'm so sorry. I'm laughing. I'm not a mom, but have you guys seen this trend, Akidoc, social media,
Yeah.
where like you see a window and you're just like, if I just... it's so dark.
Or
I'm
the
so
one-
sorry,
the
but
one
it
for
usually...
run away.
Yeah, run away. Like those things
Yeah.
finish me.
There's a day I'd had a long day,
Yeah.
and it's now 5 p.m. and my nanny came and asked me, what are we eating? I genuinely wanted to walk away and not come back. Because I'm dealing with so many decisions and things. Why are you asking me what we are eating? Are you not an adult? I was so mad.
That was the tipping
think-
point.
Oh my gosh.
I think I'm just going to laugh over there.
Oh my
So
gosh.
for me, I think what I'll just say, on top of that, what I like
Yeah.
is that for majority of mothers, if they have the right counseling, their experience is positive.
Yeah.
I think personally for me, if there's any part I loved in the postpartum, it was breastfeeding. I personally had a very positive breastfeeding experience. I'm one of the few people. Sorry if you had cracked nipples. I've never had cracked nipples.
Wow.
I've never
Yeah.
had issues. So my breastfeeding journey is so positive. So I really want that all women experience what the experience I
Yes.
had
You had,
for
yeah.
breastfeeding, because mine, it was just positive. But don't assume. So the first thing I like was what she said, that the issue was sleeping when the baby's sleeping. That will save your life. Okay, you have to learn to sleep when your baby's sleeping, because otherwise you'll be up throughout. You're going to flip. So that was my firstborn. So my second one is don't assume. Now, when I had my second baby, I was like, see, I've done these things. See, I know.
Yeah.
Oh.
Life was like, let me show
And then I listened to people who don't have babies. So unfortunately for me, I seem to add a lot of weight breastfeeding, because in as much as my experience is positive, my milk has to be coerced. And my milk only understands a nice cup of uji. So I take a cup of uji and I'll be a Tuzo grade cow. Yule number 1.
Yeah.
Okay? If I don't do this,
no milk.
no, my milk is not going to come out.
Interesting.
Full stop. So unfortunately, were those uji without sugar not working for us. The uji alone, then you add sugar, of course, kilos are going to pile up. So
Yeah.
you listen to somebody and they're like, now have you added weight? Other people are not adding weight. Now look at you. So my next baby, I decided, hey, I'm going to try. I'll take hot water instead of uji. I was with my daughter on my breast for 2 weeks. We were one person for 2 weeks.
Looking for the milk.
Because I take the hot water, I can't stand the taste, I can't stand the flavor. It's upsetting me psychologically. She's on my breast, but the milk is not, I'm not having enough letdown. I think I actually had depression, because at some point I was actually going to take a pillow and smother my daughter, because I couldn't even go to the toilet without her being
I see.
on the breast.
I see.
Okay. Then the moment I had that thought, I think God loves me, because I had like, hold on, Maureen, there's something not right here. So I sat down, being the logical person that I am. What's the problem? I went, I told my house help, please just koroga uji for me. I took a cup of uji. I drank that uji, put my baby on the breast. She slept. We finally separated after 2 weeks of being one. We were one person. We're not two separate people. I couldn't do anything without her. So sometimes do what works for you.
Well,
Thank you for that, because
Do what works for you.
when you start having dangerous thoughts, so that's your mind telling you that, like red light, you know. So please tell someone. a professional, your partner, your mother-in-law, tell somebody. And with breastfeeding, so I was different. I've shared that my journey initially was very rough, but then it became better. So I would like to share with anyone, if you feel like breastfeeding is affecting your mental health, like it's the point now you're deteriorating, so come have a conversation. And in as much as we love to breastfeed, we're not going to lose you because of so it's okay to figure out what you need to do. So I ended up doing a little bit of combo feeding at 6 months. So I brought in formula just to supplement, because it was about to drive me somewhere else. So it's those dangerous thoughts. Something called postpartum rage is also not very normal, where small things send you, like small, is relative.
Like someone else would be like,
but it's like you feel your ears are hot. You want to choke someone, like your nanny, you shout at your nanny or your partner or maybe your other children. That's it. Those are danger signs. You need to come talk to us.
What about mood? Is mood something to also look at?
I think postpartum mood is a good indicator. So if you're feeling very sad, constant weeping, especially beyond the 2-week mark, you're still crying all the time, that's an indicator that things are not okay. But beyond sadness, irritability is also a red light, danger sign. So a mood where you're just irritable, but also if you're too hyper. So if you're just excessively talking, there's something called postpartum psychosis. And yes, it presents with thoughts of harming the baby, but also it can present like a sort of mania. So you have too much energy, you're doing everything, you're not sleeping, you're talking a lot. So that can also happen postpartum. So extremes is what we look out for.
I think I'll put some resources in the description so that people can read a bit more, just to understand, what are some of the signs to look for, maybe that we haven't exhausted.
Right. Yeah.
Then now, Aki, we've talked, I normally don't notice time going, but we can't end without talking about mothers who've gone through either pregnancy or a complicated labor, and also mothers who have gone through the process of labor but have not come home with a child, because that is still postpartum. So how do we navigate these situations?
I'm so glad you brought that up, because I do have a lot of patients who get postpartum depression, but so they gave birth, lost their child, they go home, and then remember, postpartum depression is about your hormones dropping after birth. Your estrogen and progesterone were very high during pregnancy, correct me if I'm wrong, and then they just do, they crash. And then, so for women who are breastfeeding, who produce oxytocin, at least that buffers a bit in terms of mood. So now you've come home, first of all, there's a trauma of you've lost a child. And then hormonally, you're in shambles because you even don't have the oxytocin. Because what they do sometimes is they give you medicine to make sure you don't. So these women are at a high risk of postpartum depression. So a few weeks later, they develop the same baby blues. They develop the same postpartum anxiety, postpartum depression. So if you've had a loss, before you leave the hospital, you need to be reviewed by a psychiatrist, so that we just start a journey. So in the West, I think I should mention this, and it's something, my area of interest. So they are thinking, or rather there's a study that's coming up, a clinical study, whereby they want to manage postpartum depression using a synthetic analog of progesterone. I hope I've not lost you, but basically they want to replace that hormone that drops drastically after birth. So we are thinking some of the indications could be a woman who's lost a baby, just prophylactically give. Because you expect that she will more often than not
develop
depression. But so those are the women we immediately want to see. A traumatic birth, a difficult outcome. So preterm sort of thing, or you give birth and you realize your baby has a deformity, and also the loss. Those ones immediately we onboard you. So we get you. Sometimes I will see patients on Zoom, because again, you don't want to bother this woman who's lost a baby. Come to my clinic every 2 weeks, because that's really how frequently you want to see them. So let's accommodate them, because they've lost so much. So Zoom consultations, or even having joint sessions with the partner, because even the partner
Thank
has
you
lost.
for saying the partner. I was actually going to ask about that.
Yeah, and you know, the men also get depression as well, postpartum.
Yeah.
So having sessions with them, having sessions with the other kids in the house, because they were waiting for a brother or a sister. So just managing them as a family. Yeah, those are a special group to mention.
Thank you for bringing in the partners and the family.
And I'll also add,
Yeah.
and it's not just term pregnancies. You also have women who have miscarriages.
Yes.
And it's a pregnancy, there was expectation.
Yeah.
And they're almost like in the same boat as somebody who's had a term pregnancy. And you can't compare that this was just
The
2 weeks or
loss.
6 weeks and a term pregnancy.
Yeah.
You'd imagine, obviously, that somebody has been through the entire pregnancy. So we tend to be more sympathetic towards the people who've had a loss at full term. But any pregnancy loss, I think, really needs the same level of attention and bringing in the partner, because they were both, it was the two of them who created the person that they have lost. Yeah.
And I believe they should, any woman who has a loss is entitled to maternity leave. Maybe it shouldn't be called that, but take the 3 months. Yeah, you've lost.
Question. If your baby goes to term, and you actually deliver it, and maybe you should have been considered for maternity leave. Do you get it? I know for miscarriages there's still some
you get compassionate
gray
leave.
areas there.
Okay, I
but
agree.
we'll discuss.
I'm not a psychiatrist.
Yeah.
And, I have a different thing on that.
Yeah.
I believe we have to strike a balance. And one of the things that also helps people get back to themselves is doing what is familiar, getting back to their familiar territory. So my way of doing it is I try to encourage people to do things that are, familiar, used to. And when you're busy, you don't have so much time to dwell on why me.
What? Yeah, I agree.
That's so I hear you on the extended leave, and people have a different view on that. But you also look at the patient. There's that person, they really need an extended time. It doesn't matter what, they'll need more counseling and stuff like that. But for somebody who is within just what we'd call normal, we're all insane in some
some way or form.
The degree is different, but not those outliers that need medication and stuff like that. Managed well. I'm a proponent of, let's try to keep you busy, try to get you back to your normal activities, and stuff like that, as you're still going for the counseling and therapy. But okay, that would be my approach. So I'm not a psychiatrist.
So what I tend to do, because that's some of the pushback, by the way, I get from patients. They tell me, no, I need to go to work. So again, it's need-based. But what I do is maybe like go on light duty, or some people need work adjustment. So
like
for
flexible.
For my people who work in hospitals, like nurses and doctors, if you're in the newborn unit or in peds, maybe you need to, like if you're a nurse, go somewhere else, because it might be triggering dealing with newborns and you just lost yours. So you're right. It's very case by case. So
like now currently, if you lose your child, even if it went to term, you won't get maternity leave.
No, you do get. In our country, I don't think there's issues with that. The one where the miscarriages is where you won't get but they give compassionate leave.
Okay.
I believe. For my patients, I've never had an issue with that.
Okay. So we're just wrapping it up. I know we can continue, and you will definitely, I keep telling you on this, you will definitely be back, but I will find a reason to bring you back. But I was, a friend of mine sent me this TikTok video about women talking about the first trimester of pregnancy, and if you should tell people that you're pregnant before the first trimester or after? And I just wanted to find out what's your take, and then I'll explain why. Do you think you should? Do you think you should not?
I'm one of those people. I think I'm a very private person. So I it's just how you feel about it. If on a very different tangent,
Yeah.
mine was, I think the most traumatic experience I've ever had was when I lost my dad.
Okay.
But it was 10 years ago.
Okay.
It's
But
still,
Still, yeah, it's still.
yeah, but my way of coping with it was anyone who'd give me an ear, you give me like even 2 seconds, I'll tell you about my dad.
Oh,
That was, I don't know, no one told me to do this, but if you gave
Yeah.
me hata sekundi moja, itakwambia stories about
yeah.
about my dad. So I think it's something someone it's on a need be basis. If you're those people, you're open and you love sharing yourself to the world, and that's your personality, be you. So I wouldn't say there's a prescription of you shouldn't
Yeah.
or
You
should
should or you
not.
should. Yeah.
We all know that there's the tricky for us as obstetricians, there's your 6 weeks you check, 8 weeks you check, 12 weeks you check. So we always have those danger windows within the first trimester, and you get to second trimester, we're more now comfortable that yes, it's systems go.
Yeah.
But we've just talked about it, you can lose a baby at full term.
Gestation,
So it's that. So for me, be you. If you're this open person and your life's an open book and you feel comfortable telling people, I don't see why not. If you feel you're a more private person like myself, me, I'd keep the information to myself. You see when you see. So
For me, I would say, I can't tell people what to do, but I'm inclined to say don't share, but not from a fear aspect of you might lose it, the baby, but just from more of like, I think it's such a sacred time. It's so special. Like you rarely get periods of time where you have something so special going on and it's just a you thing, you and your partner, of course. So just savor that. I feel like nowadays everything is out there, especially for people who are, in the public space or online social media. And the more you share, the more you invite people in, opinions and this and that. So just have some time to just
bask in
savor
it and
that.
sit in it.
I really enjoyed that. Just having this, I'm walking around and you guys don't know.
You don't know.
You don't know. I'm growing a baby. I made a leg today. You don't know. I made some eyes.
Yeah.
It feels sacred. I don't think there's any other word.
I think in this time of social media, like you just want to keep something.
I think she's
to
a
yourself.
private person like me.
Yeah. We found out. Like she was almost, giving back. But I think why that conversation was necessary. Sorry, my phone is ringing. Is the lady said that sometimes, many times miscarriages happen in the first trimester and just when you've entered the second trimester. So her reason for encouraging women to share, if that's your style of doing it, like if you're open, is because you want the same support if you lose the baby, because now you come up saying, I had a miscarriage, an eyelash. Actually, I had I just lost a baby, but no one knew about it. So just inviting that support from the beginning can change the game for someone. But remember, you do what works for you.
That's brilliant. That's something to think about for sure.
No, for me, I'm just very clear.
For sure.
Be true to who you are. And there's some people, their life is a very
like
open
day
book.
Day 6 of pregnancy. Hi guys. Which is, it's fine. It's fine. Do you. Anyway, guys, thank you so much. I know there's so much that revolves around postpartum and, from different aspects, the mental health side, the gynecologist, even the pediatrician who we'll have later on. But it was just a nice intro to these types of conversations. Me, I've learned a lot because I'm not a mother yet. Hey, I'm saying, I'm not a mother. Let me remove that yet for now. For
You
now,
can, you can call us. We have the debate about
You
whether
have a
to
lot
have
of
children or
support.
not.
Yeah, the debate.
I'll talk with her a little bit later.
By the way.
But before we wrap it up, what's one thing you want to tell moms out there, especially revolving around getting back to, or not getting back, but just morphing into this new you who is a mother? Yeah.
For me, I'd say let go of trying to get back to who you used to be. Let go of that, because sometimes it can really put pressure on you, because you're like, okay, let me lose the weight. I need to fit into the clothes I used to wear before, or I need to be the type of person that I was. I think matrescence, when a mother is born, it's called matrescence, is beautiful, and it just takes you to the next level. So learn to love the new you, give her space to be. Stop trying to tell her, no, go back. Just, you're now on this level and it's fine. And I think it just keeps getting better. So if you're in the thick of postpartum, it actually gets better. Or if you're now on the side like you've not even started, I think it's an upward trajectory.
Okay.
So, and I think it's beautiful.
At the end of the day.
I think I'm saying more or less the same thing.
Yes.
Just listen to your body.
Okay.
Yeah, your body tells you, I'm ready for this. I'm not ready for this. Yeah, just listen to your body. It gives you a very good indicator of I'm well, I'm not well, and because we said health is not just physical.
Yeah.
Also listen to your mind.
Yes.
It's so yeah.
Okay. Me from the sidelines.
Yeah.
Because I think I see a few mothers struggling with this. We said you don't strive to be superwoman. You're the best thing to your child, but also it's okay to ask for help where
Yes.
you need it, and you can also define how you'd like the help to be given to you. So just because someone is helping you here, maybe that's not what you need at the moment. You can also just speak to them and be like, I probably need this done this way right now. So yeah,
I love that.
yeah, that's what I would say.
I love that.
You sound like Superwoman already.
Yeah.
You're
ready. You're ready.
Wanapanga
Supermom.
kunimaliza. Wanapanga kunimaliza. Anyway, guys,
I'll encourage you, my dear.
Yeah.
For me,
yeah.
motherhood has been the most beautiful journey. I say it's the one blessing I have in my life that really I can't attribute it to anything special or fantastic about me. It's just that blessing, but it's a beautiful journey. And I'm just one of those people. I'm like, even when I'm buying a gift, I'm those people. I wouldn't buy something that I feel I wouldn't want. Okay, maybe I haven't gotten into your mind. Maybe you want something different. Yeah, but I just like that. If it's something I like, I'd like to project that other people also have a similar experience. So don't be scared. It's not the way people make it sound. It's challenging. You understand? But what is life without challenges?
Not life.
Not life, actually.
Yeah, that's true. Actually, and we're not going to discuss this, by the way. Let me just tell you, the only reason I'm scared of motherhood is labor and delivery. Nimemalizia hapo. You're not discussing
We'll
it.
sort you out.
Hey,
yeah.
my goodness.
See, I told you I've got bags. I've got tricks in my bag.
Oh,
We'll
I
sort you
knew
out.
I wasn't going to labor. I
Me,
knew.
traumatized. I can deliver your baby,
Yeah.
but me.
Maybe we shouldn't be talking about this on camera, but I'm so glad I had a CS.
And imagine it's fine for me. I'm one of those like we'll take you through, and for me, as long as it's an informed consent and we all understand what we're going to go through and what the risks and potential complications are, everyone is entitled to care at the end of the day. And we all can't fit in the box. Personally, I really encourage mothers to have natural deliveries. I'm one of those, but I'll not say I've never done a cesarean section for a mother who felt that this was not for her. After a lot of counseling, a lot of talking, and we just agree. It doesn't have to be a fight.
I think that's really important, having a birth plan with your doctor.
Yes.
Because what we discussed was So I shared that. Of course, she knew I had anxiety and all that.
Yeah.
So we shared that I will try.
Mm.
But I told her at the first sign of anything, we are
Run me to the
yeah.
theater.
So I mean, we were a bit post date.
Mm.
I was induced once, twice actually. When the second one didn't work, I was like, okay, I've tried. I
Yeah.
tried my best. And interestingly, I didn't even have a single contraction.
Mhm.
I think God just knew it's not for me.
Mm.
So it's okay to not know yourself
Yeah.
and communicate with your doctor.
Sorry, and I really like to also draw on that. Sometimes even for labor to go well, the mother also has to have psyche. It's one of the P's on how labor is going to progress well. So the mother's not having the psyche, your labor is also not going to progress well. So
Yeah.
sometimes don't fight the progress too much. It's how do we motivate, how do we encourage, how do we educate? Yeah, we're not able to get on the same page. How do we support?
Yeah.
And healthcare has evolved. Your healthcare provider is more a supportive function than before.
Yeah.
Before we're like
decision maker.
you're taking augmentin.
100%,
Yeah, next.
Yeah.
Now it's a more consultative. We have patients are more empowered and more in charge of what's happening in their care. So it's a shared process.
Yeah.
So I think that's what I'm liking about how medicine
Is
has
evolving.
evolved. Yeah, because as an individual, you are responsible for your own health.
True.
Yeah.
That is very true. And on that note, we are gonna wrap up. Where do you want to be found? Do you want to be found? Plug yourself.
Yeah. I mean, I think just search for Dr. Vundi, Vundi, on Instagram, TikTok, LinkedIn, YouTube, wherever you listen to your podcasts, you can find me, and I can share my email address as well.
Okay, that's nice.
Yeah.
Okay, I'll put them in the description as well as over here, down here. Just your handle down here, email in the description.
Good.
Doc, yourself?
Maybe next time tapena introduction kama hiyo.
But
for the time being, as we are physical,
yes.
we're at 40 Suits, Gynaecare, Dr. Owiti, Maureen.
Okay. Thank you guys so much for coming. And no. And for me, you can find me. My name is Dr. Hoopsimi. You can find me on Instagram. There are some hyphens, but don't worry, it'll be here, and on TikTok. And for the podcast, A Dose of Health, on Instagram, on TikTok, on Spotify, on Apple Podcasts, on YouTube, and on Apple Podcasts.